I would like to introduce now one of the technical experts that CBM is very privileged to have on our staff. Poonam Shah is CBM Global's Inclusive Eye Health Advisor, and she is going to talk to you about a little miracle. It is an incredibly innovative and very cheap way that CBM is helping to expand eye care in some of the lowest income settings. Poonam.
Thank you, Kirsty, and good evening, everyone. My name's Poonam, as Kirsty mentioned, and I work with CBM Global as a technical advisor. As mentioned, I'm going to talk to you today about the Arclight, which is a little piece of innovative technology that we're promoting in our inclusive eye health projects. So I just have a little video here to show you. So we're partnering with the Arclight project and St. Andrews University to promote this device, which I have over here and I'll show in a moment. But in essence, it's a little direct ophthalmoscope, which is a piece of equipment to look inside the eye and assess structures inside the eye. On the other side, it's a little loop, which is a little magnifier to magnify the front of the eye. And it can also have a little attachment put on to make it into an otoscope to look inside the ear. So it's a little nifty piece of equipment that's also very portable and accessible. So we're promoting this. So it has an LED bulb and charged by solar and also USB-C. And over here, it's just showing the loop to look at the front of the eye, just like that. So it's to assess for any eye conditions that need referral onto tertiary services. And on the other side, it's the direct ophthalmoscope. So it can be used to assess the reflex, so fundal reflex, looking at reflections coming on from the back of the eye, and also to look inside the eye, as is shown on this video, to assess structures like the optic nerve and look for signs of glaucoma, let's say. So if the light is made a bit brighter, this is what I was talking about before, a little attachment called a speculum could be added on to then assess the inside of the ear to look for abnormalities in the ear. So this device is between 18 to 24 pounds. And we've been promoting this in our projects across the globe and the countries that we work in. It's just as effective as equipment that you'd get that's on a larger scale and similar. Just as effective, but costs a fraction of the price. So if you went to buy an ophthalmoscope or an otoscope, it can be between £100 to £1,000. So at 18 to 24 pounds, it's a really good little piece of kit. I've used it myself, and I've seen it being used out in the communities as well. And it comes in this little kit, as you can see here on the picture, with a little thing to kind of get the attention of little kids, let's say. It has a little vision chart that they've developed that you could kind of measure vision with, and it has other bits to measure near vision, which I'm sure a lot of you have reading glasses, and it's to assess near vision issues as well as problems of the macula as well. And along with it, it's got an attachment that you can put onto the back of your phone and put the little device on to take pictures. So it can, in essence, be used for telemedicine as well, if it's promoted. So it's a really good piece of equipment, and it comes in this little kit. And what we have been doing is promoting primary eye care, so taking services out to the communities, as Kirsty was mentioning in Nepal. There's lots of regions where eye care specialists are scarce, and so we're promoting community health workers to be trained to use these devices. And the Arclight project and St. Andrews University have developed tools like this and little pages like this that can be used to train community eye health workers in eye as well as ear care, and to pick up very early on any eye conditions that can be treated very easily and referred on. So we try and link up these services. These are just a couple of pictures from trainings that we've done over the last sort of 3 to 4 years. So just on the top there, that's Andrew Blakey, who's leading the Arclight project in St. Andrews University, and we've partnered with them. And in that picture, he's doing some training for some healthcare personnel in Zimbabwe with some simulation eyes. And the way we do this training is a training of trainers. So we'll train with him and with some of our team, a small cohort of people in the country who can then do cascade training. So they go on to train other personnel. So that's how we create a bit of sustainability in the training that we're doing. Earlier this year, I was in Laos with that picture at the bottom left, and we did some training for some health personnel there. And here on the right is actually a picture from Nepal. So this is a field worker who does door-to-door screening and who's part of the project in Nepal. And he's using the Arclight there to look inside the ear. So that's where we work very closely with the municipality government to identify through the census how many people are living in the villages, and everyone will be very systematically screened for eye conditions, ear conditions, but also other health conditions like blood pressure and diabetes, and then referred on to the main hospital if there's any issue. So I've seen it being used live and in action, and I was actually in Nepal just 3 weeks ago, and that's a picture that I took there. So it's being used very extensively in the communities. Just to give a little bit of an idea of kind of what the work we've done over the last 3 to 4 years or so. So we've trained in various countries, which I've got there on the left: Burkina Faso, Kenya, Laos, Madagascar, Malawi, Nepal, and Zimbabwe, around 2,000 health personnel. That's a majority of those are community health workers who work out in the fields. They're part of the communities, but it also includes nurses, ophthalmologists, and optometrists. And we've distributed around 2,600 Arclights in these communities. And just to give you an idea of impact, in Madagascar, where 100 health personnel were trained in October last year, since November 2024 till April 25, in a newborn screening project, 23,000 babies have been screened through their local vaccination camps and initiatives. So we partnered with the maternal health departments, and already 4 cases of retinoblastoma have been identified, and that's a cancer of the eye, which is actually life-threatening, and 3 cases of congenital cataracts. Amongst that, around 60 children were referred on for other eye conditions. So that's in the space of around 6 months or so. And just to give an idea of how many children were screened before that, so just in 2023, around 4,500 babies were screened in the whole year. So already in 6 months through this device, we've been able to screen 5 times more babies and save the life as well as the sight of these babies. So through the project, we've then been able to link them up with other services to provide treatment as well. So that's just a little bit of a summary of this device. We've been promoting it extensively. It's impacted a lot of people and still is. And we're hoping to scale this up going forward in our projects across the world. And this is just the beginning. The journey's only just started. So the St. Andrews project is developing attachments to measure eye pressure, considering putting cameras and lasers and all sorts of interesting things that we're trying to support. So we're very excited for what's yet to come. So thank you very much.